Hello everyone, welcome back to Dave's Professional. Today I'm here with Dr. Pranali Patel. How are you doing, Mrs. Patel?
I'm doing well, thank you. How are you doing, Gautam?
I'm also doing good. Thank you for sitting down with me here today. And yeah, let's get into the questions. What are some things which really pushed you to go into the healthcare industry?
Throughout my childhood, I saw my parents who were in the healthcare profession. My mother's an endodontist, my father is a CT surgeon. So I saw them providing direct care to their patients, and I always thought it was a very noble profession. So, since that's all I saw, I thought that was the way to go.
hmm And what made you choose dental? Is it because your dad was an endodontist too?
Yes, my mother was an endodontist. My father is a cardiac surgeon, but I chose dentistry because dentistry has more of a work-life balance.
hmm
I saw my father waking up in the middle of the night, running to work. There were emergencies that needed to be dealt with. It's a lot of workload. It's a lot of responsibility on your shoulders. I did want to provide healthcare. I wanted to provide care, but I also thought that this was a slightly more easier option where I could manage my home and I could be a professional.
hmm And what would you say are some of the different fields in dentistry, and how would you say your field is different from the others?
So there are general dentists. So you just go through 4 years of dental school and you're a general dentist. You can specialize a little bit further and you can do AEGD, which is Advanced Education in General Dentistry. That's a 1 or 2 year program. Or you can specialize in the other fields, which are a little more specific, which is one of them is pedodontics, which is child care, child dental care.
hmm
Then there's periodontics, where you're dealing with the gums. You do gum surgeries, you place implants, you do bone grafts. Then you're an oral surgeon, but that involves going to medical school as well. So it's a kind of an integrated program. So it's you deal with all kinds of. I mean, people have trauma. You deal with those. You place metal plates in their mouths. Then you have orthodontics, where you deal with braces, and then there's endodontics, where you do root canals. The way it's different is that I chose it because I I do like details, and I also it's a more satisfying job in a way that you provide most of the patients that come to us, they're in pain,
hmm
and this is the one field that somebody who walks in with pain can actually walk out without that pain, and it's very satisfying to see that
hmm
when you're a pain doctor like my husband. Then people come in with pain and they are relieved. There's some amount of relief, but it's not a lot of times it's not 100%, and people come back and you have
hmm
to continue the treatment here.
Right.
I do the root canal, pain is gone, they're
Satisfying.
good and they're well.
Yeah. And that's good. And you say that endodontists make up
Endodontics, uh-huh.
endodontics make up about 3% of the dental industry. Would you say it has a small population because the workload is more, or would you just say it's a harder specialty in general?
So workload is not more to begin with. We see about 6 to 8 patients a day. Each patient is we take about 45 minutes to an hour 15 per root canal. It is a busy day, but at the end of the day, you can leave your work at your workplace and go back home. So it's a good profession. It is harder to get in.
Mhm,
There are about 67 accredited dental schools in the country,
mhm,
65 to 67, I think, and
mhm.
each class is a class of 100 people.
Ooh.
So if you're looking at the number of dentists graduating every year, you have 67, 6,500 people graduating every year. Now there are about 50 to 55, I think, dental programs, endodontic programs, and each endodontic program has on an average 2 to 3 seats, 2 to 4. So so you're talking about,
One in 100 per year.
yes, about 250 at the most seats in the United States when 6,500 people graduate from dental schools. So
Mhm,
that's one part of it. It's a smaller available, lesser number of seats available. Another component is finances. When you go through dental school, each year you're paying. If you go out of state, then you're paying a tuition of about $30,000 to $50,000. If you go northeast, it's closer to 50. You stay
Right.
in the other state,
Right.
25, 30. But
Mm-hmm.
still, at the end of the year, at the end of 4 years, you've accrued a good amount of loan burden. And most people like to get out of dental school. They practice, they start their families, and then they
Mm-hmm.
earn some money back before they can put invest it back into
Right.
doing a specialty.
Mm-hmm.
So, and but then as time goes by, once you start working and you feel comfortable, a lot of people don't want to go back and specialize.
All right.
So, but the ones who do, they persevere, then there are other fields, and they can try and get in
Mm-hmm. And
programs.
did you do that as well, where you did your 4 years, then you worked for like an X amount of years, then you went back,
I work for 2 years, yeah.
and then you went
I
back
work for
into.
three.
Mm-hmm.
Go ahead.
No, no, it might be you. Go. Continue.
No, yeah, I finished my dental school, then I worked for 2 years, and then I joined Endo,
Mm-hmm.
the Endo program.
Did you
Yeah.
join the endodontics program at Case Western Reserve University?
Yes, I did.
How would you say your experiences from Case Western Reserve University has helped you in your career?
Has helped me. Well, the Endo program is a very intense one. You can have either a 2 year or a 3 year program.
Mm-hmm.
Most of the programs are 2 year certificate programs, or 3 year masters. But
Mm-hmm.
mine was a 2 year master's program, so I had to do my thesis and
Mm-hmm.
at least 300 patients, 300 root canals.
Oh.
So that, and there are you have to go through all the basic science subjects like anatomy, physiology, all of that, like, all over again.
Oh.
So it was a very tough program. But I think what you might be trying to ask is, how did my dental school experience help me get into endo? Is that what you're trying to ask me?
Yeah, yeah, yeah. Imply that, yeah.
Okay, so how it helped me choose endo?
Mm-hmm.
Yeah. So when I went to dental school, what we have is rotations. So when we start clinicals in the third year, and so third year you start seeing patients, and then fourth year you rotate in every department. And I also had an extra fifth year, which is called an internship year, where we went to oral surgery for a month, endo for a month, perio for a month, and so we got a good chance to practice dentistry as those as that I mean as a periodontist, as an endodontist for a short period of time, and that helped me decide whether I wanted to do endo or not.
Mm-hmm. And I'm guessing like rotations were really helpful to like a lot of people to really get a feel of what each specialty really holds, right?
Right, right.
And in your specialty, you use irrigation as a vital part, right?
Hmm, hmm.
And you've also done research and studies into the mutagenicity of precipitates. What are some
Yes.
research results you had got from this research study?
So I'll tell you a little bit about my study. To clean out the root canals, we have three kinds of irrigants basically.
Mm-hmm.
First is sodium hypochlorite, which is essentially your bleach. We don't tell patients that, but so when we say pass the sodium hypochlorite, we don't say
That's
pass
the
the bleach.
bleach.
Because we don't want to
Don't
scare
want to
them.
scare them, yeah.
But that's basically what cleans out canals. Second thing is EDTA. It's a chelating agent. And third is chlorhexidine. Now, what people found is that when they use sodium hypochlorite and EDTA, it formed a white precipitate.
Mm-hmm.
When they used chlorhexidine right after using EDTA, nothing happened. But if they use chlorhexidine right after using sodium hypochlorite, a brown precipitate was formed. So people started to wonder what the impact of this precipitate would be within the canal.
Mm-hmm.
The white precipitate that was formed between sodium hypochlorite and EDTA, that was you could easily get it out of the canal. It didn't block the canals or anything.
Mm-hmm.
But the brown one, people found it to be carcinogenic, which means it
Oh.
caused cancer. So people were really afraid to use it because they said, oh, even if I make a mistake and if I use a drop of chlorhexidine with sodium hypochlorite, somebody can sue me for if they
Right.
for cancer.
Mm-hmm.
So it was just a fear. But so I retested that the precipitate using a different technique. It was a special kit that is produced in Canada.
Mm-hmm.
I retested it, and I found that there was no clear evidence that it created carcinogenesis. It was carcinogenic.
Mm-hmm.
So it's not a great idea to voluntarily create that precipitate. So I don't want to do that. But if
Right.
I do it, at least I'm
Right.
not fearful of causing harm to the patient.
Mm-hmm.
So mhm.
Yeah, you know that's
How
it's safe. You know it's safe for the patients to have.
right. Say as long as I'm not introducing any harmful irritants into the patient's
Mm-hmm.
mouth,
Mouth.
into the patient's body,
Mm-hmm.
I'm fine. Yeah.
And
But the way to avoid creating that precipitate
mm-hmm.
is to use EDTA between sodium hypochlorite and chlorhexidine.
Oh.
Then you don't get that precipitate.
Yeah, that's good to have. And it seems that you went through rigorous research to and studies to get your actual conclusion that it was not really
Yes.
carcinogenic. So, what would you say are the key skills which are needed for endodontists to be successful in your field, other than the office book knowledge?
Well, things that people don't teach you in residency is patient communication and dealing with patients, and more importantly, dealing with the general dentist who send us their patients.
Mm-hmm.
So you know how general dentists market to patients. You can you spread the word that okay, this person is a good dentist. We
Right.
don't market to patients, we don't market to people, we have to market to general dentists, because
Oh.
they are the ones who first see the patient,
Mm-hmm.
determine if they need a root canal, and then send them to us.
Oh.
So so um, that communication, we have to make sure that it's clear. There's a lot of scope for misunderstandings, for all that kind of stuff, when there's a patient that's being
Right.
passed from one dentist to the other.
Mm-hmm.
So that, and then making sure that the patient's expectations are met, that everything is clearly communicated to the patient. Patient is pain free, most importantly, during anesthesia, to give pain free anesthesia, because
Mm-hmm.
that's the only part they feel. And that determines how their entire experience is going to be. Even if you do the best root canal in the world, if they felt pain when you're numbing them, they're going to be like, the dentist was okay.
Shoot, okay. Yeah. And how do you like after they do come and they have done it after they've done the root canal, there has to be like some rules and regulations what they should do, what they should not do. So how do you
Right.
the patient follow that? Because I know some patients might just like go back into whatever, while some will follow it. So how do
Right.
you make sure that the patient follows it?
Right after the root canal, I go over everything with the patient. And then and then I leave the room, and then my assistant goes over that same thing with the patient again on the way out. And at the checkout counter, they're given a written page of instructions, so that it's
Triple
it's
check.
reinforced.
Yeah, you triple checked it on the way out to make sure that they're gonna do it.
Yeah, yeah.
Hmm. So along with root canals, what other procedures you perform on people?
So root canals retreatments are a main big part of our procedure. I mean, a big part of our practice. Retreatment is basically a root canal that's been done by somebody else, typically a general dentist. Either they've not found all the canals, or it's gotten reinfected for whatever reason, or if they break an instrument in those canals,
Oh.
then we see them. We try to take that instrument out, or if not, we bypass it.
Mm-hmm.
Another thing that we do is surgery. We do apicoectomies.
Oh.
That's the word for that's another word for that is root end surgery. So basically, when there's infection at the end of that root,
Mm-hmm.
if you cannot get to it from the conventional way, which is through the root, I mean through the tooth,
Mm-hmm.
then you go the other way, where we flap the gums,
Oh.
remove the bone in that area, cut out the end of that root, scoop out the infection from the bone,
Mm-hmm.
place a bone graft, place a membrane, and then suture the gums back.
Oh. Is
And
that
that's a more invasive procedure. We don't always, we rarely, I mean, we don't need to do it as often as the other procedures, but
mm-hmm.
if you do a regular root canal, you found all the canals, and the root canal gets reinfected. Then you go back in there, you clean everything out, you retreat it, and wait and watch. If it still doesn't heal, then you go in and do an apicoectomy.
Mm-hmm.
But typically, the conventional methods work. The success rate of root canals are about 95 to 98%. Success rate of retreatment is about 87 to 89, which is not
Has,
bad,
but it's like a little bit.
but it's not as high as a regular root canal just because the bacteria have been there longer. They're more resistant to our treatment. And success of apicoectomies is in the high 90s because you're actually going in there and scooping everything out.
Everything's not there anymore.
Yeah,
So, out of all of these procedures and all the procedures you do, what would you say is the most challenging procedure you have performed? And why would you say it is challenging?
I would say apicoectomies,
Is it you're like,
just because of how much, just how aggressive it is.
mm-hmm,
It doesn't take longer than a root canal. It takes about 45 minutes or so, but in patients where bleeding control is a very important factor. If I can get good bleed control of the bleeding in that area, then I can perform a surgery very quickly.
mm-hmm,
But if there's a patient who has a tendency to bleed more or who's on aspirin for cardiac conditions or any kind of blood thinners that they cannot stop taking, then it's quite a risk.
oh,
Then, yeah. Or if the infection is very close to the maxillary sinus, then sometimes while scooping out the infection, you end up you end up opening up the maxillary sinus. There's a
oh,
communication between the sinus and that infection.
mm-hmm,
And then you have to place a membrane and then patch it up. Place a bone graft in
oh,
there, and it's a different technique.
right.
There's more. Yeah, it just gets a little more complicated.
Mm-hmm. What is the
There's also,
effect
good,
of what is the effect of aspirin and blood thinners when you're doing a surgery?
more bleeding.
More,
Aspirin causes bleeding,
mm-hmm.
so you want to control the bleeding. Otherwise, you're not going to be able to stop the patient from bleeding, and then just yeah, a
Do
lot of things can happen.
do you have that 24-hour rule where before you're doing that surgery that the patient can't eat or drink anything for 24 hours?
About 12 hours, we say, and the only reason is because if they need to use the restroom, then
Mm-hmm.
really we can't stop the surgery in between.
Right. You can't.
Other than that, we there's really no good reason.
Mm-hmm. It's just like just to make sure that nothing stops the surgery in between.
Yeah, it's a 45-minute to an hour long procedure.
Mm-hmm.
But if the patient has to get up, then they're going to go to the restroom, look at all the blood all around their mouth, and they're going to freak out
Where's the blood coming from?
from the gum that I just cut open.
Yeah. And could you explain some of your day-to-day responsibilities you have as an endodontist?
Sure. So I go into work at about 7:30 is my first patient, and then my assistant takes X-rays. While they take X-rays, I review the medical history that the patient has already signed and filled out, and I read that in the room. The assistant comes in, they go over the patient's complaint, and I go into the to the room, talk to the patient, get blood pressure, ask about medications that they are taking, and we get started with the root canal. Once I'm done with the root canal, uh, sometimes in there's a period where we stop and get X-rays. There's a period where we measure the length of the canal,
Mm-hmm.
and we place the filling material, and we get an X-ray to make sure that the filling material goes all the way to the end of that canal. So sometimes when I get out of the room and let the assistant take the X-ray, then I can quickly go and see another patient, do another consult in that time,
Right.
because some people don't want to do treatment the same day. They want to
Right.
come in just to get an opinion. So I
Mm-hmm.
do that, come back, get back, finish this root canal. Once I'm done with the root canal, then I need to make sure the notes are written well.
Mm-hmm.
The assistants generally type out the notes, but we have to go over them and we have to make a letter which has the before x-ray, the after x-ray, a recommendation for what
To
the
do.
treatment plan should be next for the general dentist, and then we email it to the general dentist.
Oh.
Once that is done, essentially our job is done. If there are any if there's anything that needs to be communicated to the general dentist about the patient, then I
Mm-hmm.
do that in the time between the time that my patient is done and before my next one's ready.
Mm-hmm. And how many patients do you see on an average day?
About 6 to 7.
So about.
Well, six treatments and about 2 to 3 consults.
Mm-hmm.
So about 8 to 9 patients.
Mm-hmm. And what would you say are some skills you have gained while working with these patients over your years?
Mm, say mainly communication and how to make them feel at ease.
Mm-hmm. Yeah, this is
Other
important.
than that,
Mm-hmm.
yeah, and how to deal with various situations.
Mm-hmm.
Um, mm, mm, Clearing expectations. For example, if patient comes in with a broken instrument in his tooth, and first of all we call the general dentist and say, hey, did you tell him? and, then, and then we go back, and the hardest part of our job is, as I said, we do a lot of retreatments. The hardest part of our job is to find a solution to the patient's problem, to pacify the patient, and to do a great job without making the dentist look bad. It's true. It's like, he tried, he really tried, but your canals are very curved.
You gotta blame it on the
And
canals.
we have right, we have microscopes, so we I can actually look into that canal half almost all the way down if it's a straight canal, and I can actually get that instrument out.
Mm-hmm.
No, we
How?
have the ability to do it, whereas general dentists don't. So we explain that to the patient that we have certain technology that helps us do a better job.
Mm-hmm. And how has COVID really affected your line of work?
COVID, it was very slow earlier. We have four offices. We closed them all down except for one.
Mm-hmm.
So because we wanted to mitigate risk, I mean exposure.
Right, right.
So we just worked out of one office. The patient load was less, so it didn't make a difference. It actually helped us out. And then I think 3 months into the pandemic, um, we opened our offices one by one, and by September, October, people were coming in with with um,
No
I mean
bookings.
infections that hadn't bothered them for years. So it's like, okay.
Yeah. And what do you say was the biggest challenge or difficulty you had to face as being going to work in the pandemic?
Biggest challenge, the PPE. Oh my gosh, I had to wear a gown.
Mm-hmm.
I mean, that went back to front, and then another one front to back.
Mm-hmm.
Um, N95, over that a surgical mask,
Oh,
your face shield, head cap.
yeah.
I felt I couldn't breathe.
You gotta stay safe
That was
somehow.
a huge issue.
Mm-hmm.
Yeah, and then things that otherwise I would grab for, reach out for, and then my assistant would spray it down later. That was generally we would do that. The assistant is slow. You go ahead and grab something
Mm-hmm.
yourself, and then they're gonna wipe it down and spray down. Here we're like, okay,
No, we're gonna do
cannot do that.
it.
Just gotta wait for the assistant to give it to you.
Yeah. And does your place of work offer any internship or volunteering opportunities for high school students?
Yeah,
They,
yeah, of course. Whoever's interested come. Typically, dentists come because they are trying to figure out if they really like endo or not.
mm-hmm,
But anybody who's interested we're happy to have them shadow us
mm-hmm.
just to see how our day-to-day life is.
Yeah, that's that's good.
So got them whenever you're ready.
Whenever I'm ready, I'll just give you a call. I'll shoot you an email. I'm ready to shadow you right now. Can I come tomorrow?
Yeah.
Full mask and gown, I'll be ready.
Hey, there's more than a mask there.
And the N95 and the face shield and the gloves.
Yep.
Yeah. And then how can a high school student really get involved in your line of work? Like what courses should they take? What books should they read?
Typically, you have I mean, to get into dental school, right?
Mm-hmm.
You have to. There are certain requirements. Dental. I mean, medical. To get into any medical field, undergrad. I don't know the details honestly,
Mm-hmm.
because I did my undergrad in India,
Mm-hmm.
so I
Yeah.
don't know what it's like here.
Right. A little bit
Yeah,
different.
yeah,
Right.
it's very different.
Mm-hmm. That's true. That's true. And then what do you say are some interests people should have if they're going to come into the dental field?
Um, Basically attention to detail.
Mm-hmm. Because teeth are small.
Um, Small, very small, and you have to do artwork essentially in those small teeth.
Mm-hmm.
Um, Compassion,
This is needed.
wanting to do your best, just be ethical, willing to learn, because you're always learning. Even if you're out of school, I'm always learning all the time through my colleagues, or sometimes somebody puts up a case and you're like, huh, I may not have treated this. If it had come to me, I would have been conservative and told the patient, no, but this person treated it and it worked. So the next time somebody comes to me with that kind of a tooth, I will tell them, I
Mm-hmm.
learned so much from other experiences.
All
Just
right.
somebody who's willing to learn,
Mm-hmm.
um, and work hard, because dental school is freaking hard.
Yeah.
It really is, because and there's a lot of stress that goes, because the final year, you basically the exam is not a written. I mean, there you do have written exams, but you have to test on patients, and so you have to make sure you get your own patient from wherever,
Oh.
and they show up.
So you have to go and recruit
And they want you
somebody.
to work on it. Huh?
So you have to go and recruit somebody to give them a root canal.
Yes, and it's very stressful, because some people, there have been times, I mean, I was working in the clinic where people's patients didn't show up and they were all stressed, or some people's patients were extorting them for money, saying, I'll come, but you pay me.
So is it just
There's
like
a
a
lot to deal with.
is this like a free surgery then? Like if you recruit
Yeah,
somebody.
if it's an exam, it's minimal fee, or actually nil probably.
That's gotta be hard. So I mean, that's kind of hard to just find a patient of this where you can't really go door to door and be like, "Do you have a root canal? Do you have? I can perform one."
And not just any, you have to have a specific kind of cavity, and it has to be approved by the examiner. So you have to call the patient, you have to get them examined by the examiner, and then they say yes, then that you have to just pray to God that that patient arrives at time.
Hopefully they come
Some of my friends even went and picked up their patients early in the morning at
just to make
6:30.
sure. Wait, what happens if they don't come? What happens to the practicee?
You basically have to take your exam again after 6 months.
That's tough.
Yeah.
You've studied for 6 months.
Exactly. You know your stuff. You just there. You basically have to depend on other factors, just not
Yeah.
yourself.
Nothing you can do about that, I guess. Yeah, and my final question is the dental industry in general has experienced growth over the last 5 years, and it is still expected to grow 6% through 2029. What would you say are some reasons for this overall growth?
Awareness. A lot of people are more aware of that they have to take care of their teeth. There's you're reaching out to people in all parts of the country more. There's more
Mm-hmm.
technology. There's better technology. Insurance companies are allowing people, are making healthcare, dental care more accessible. Um,
Mm-hmm.
Technology makes us be more efficient, so we are able to see more patients.
Mm-hmm.
And
Yeah.
there are also these big commercial giants, like just big companies that come and take over dental offices, and they've made it they they're making it a big business. So
Yeah.
yeah.
And yeah, those are all the questions I have for you today, Mrs. Patil. Thank you for sitting with me again. If you have any questions, I'll leave my email down below. And yeah, bye.